Hi guys, how are you doing today? Dr. Stroud here with Cornerstone's Pet Tip of the Week. So I know it's summertime, I know you guys are going on vacation and you are getting just to relax for the year, and maybe you're going somewhere fun and awesome. I hope you're going somewhere fun and awesome. And you don't want to have to worry about what your fur baby is doing at home or what your fur baby maybe how they're doing health-wise. And so today we're going to kind of talk about a complex that we want to make sure that your pet is safe against while you're gone on vacation and while your pets are boarding at different facilities or with your veterinarian at the hospital if they do boarding. So we're going to talk about something called canine infectious respiratory complex. CIRD is the acronym, and that is something, it's a new developmental term for something that a lot of people and a lot of you may know as kennel cough. Yeah, and so we're going to talk about kennel cough today. Again, the new name is canine infectious respiratory disease complex. The reason they've changed the name is very important, and it affects what we need to know about kennel cough. So when we're talking about kennel cough, you know, it used to be think that was by a primary bacteria that caused respiratory disease or disease in the lungs or the windpipe, and it was thought to be by a primary bacteria, by a single one. Well, it's actually over the last 15-20 years we've learned that many different viruses and bacteria can contribute to kennel cough or canine infectious respiratory disease complex. Things can include our parainfluenza, canine adenovirus, certainly canine distemper virus can predispose them to that. You do have the Bordetella bronchoseptica, which is a bacteria that takes advantage of the inflammation already created by lots of viruses. You can have mycoplasma, you can have a number of different things, and thus the name complex. The name complex is in the name because it is a complex thing, and it can be caused, you know, by many different viruses and bacteria can pair along to cause the disease known as kennel cough or canine infectious respiratory disease complex. And so what are we talking about when we know we use all these viruses and all these names? Okay, great, but what symptoms are we talking about? What is your dog going to act like if they have canine infectious respiratory disease complex? Things that you most likely have is a very loud and harsh cough that isn't always productive. Other things maybe it sounds like your pet is maybe retching or gagging. Sometimes they can even have excessive drooling because they are coughing so hard that their windpipe and their upper airway is so irritated that they can have excessive drooling from it. So all of those can be related to kennel cough. Now, why do we care? One, we care because your pet, when you have inflammation like that, it hurts, it's painful. Two, it predisposes them to pneumonia, which can be a life-threatening disease. So we definitely don't want to predispose them to that. Three, it is highly contagious. And so if your pet is around other dogs who've had that, your pet could end up with it. And if one of your dogs can get it, then that dog can then spread it to your other dogs. And so it's really important to make sure that we're taking preventative measures against this thing so we don't cause a problem, because we don't want your animal to be in pain, we don't want them to get sick, and we don't want them to spread it to anybody else, any other animals. So what can you do to make sure that your pets are protected against canine infectious respiratory disease complex? Well, there are a couple of things. You know, we talked about distemper virus being one of the viruses that can predispose them to this. So you definitely need to make sure that your pet is vaccinated against canine distemper. Okay. Other things that they can predispose: canine influenza virus, both H3N2 and H3N8. Both predispose and can be a part of canine infectious respiratory disease complex. Guess what? There's vaccinations for those guys, so we can decrease the risk of your pets getting that. There's also vaccinations that cover Bordetella or parainfluenza. And so those are all three of those vaccinations can help your pet be safe. And so in general, prior to your pet boarding at a facility, you want to make sure that they've had those vaccinations 4 to 6 weeks if you can. That is the best situation. Of course, if you do not get them in before that, any vaccination is better than none. They just may not have as good a protection as we like. And something important to remember, guys, is that no vaccine is 100%, but vaccinating is important because it decreases the risk of them contracting that, and it just helps them feel better. It protects them a little bit more, and it reduces the risk of them, the severity of the disease. Okay, so if they were to contract this, it does not tend to be as severe as if they didn't have it. So again, it's a big deal. I know you guys want to go on vacation and relax, and the last thing you want to worry about is getting home and coming and picking your dog up from the facility that they were boarding at, and then them starting coughing and getting sick. So we do not want that. So vaccinating your pets against those 3 things is going to make a huge difference for them, and it's also going to just make them feel better. It's going to make you feel better because you have the security of knowing that they're protected, and giving them the best medicine, the best health care. So that is it. If you have questions about any of that, about canine infectious respiratory disease complex, about vaccinations with any of this, please drop them below. As always, thank you for all of you guys that are watching. I see a couple of you have said hello, so hello to you guys as well. I'm so glad you joined us. And then, always drop by, and even if you're watching this on replay, drop a comment and say hello. Let me know you were here and you were watching, and let me know any other information you guys have questions about. So I'll chat with you later. Have a great Monday, guys. Bye.